So this was back in 2015. I decided I wanted to build a very scalable business. And I also decided that I didn't want to do it in Sweden. And then I found out that the healthcare system was not really working well in India, especially when you have like a mismatch between the doctors and the population, where most of the doctors lives in a city and then the population lives in the rural areas of India where you don't have the doctors. So I then decided that I want to do a healthcare business in India. I think the most important thing was that delivering quality healthcare to the patients. That healthcare should also be affordable and accessible.
So at DocOnline, we are driven by care and powered by technology. Well, our vision is to provide proper healthcare to families, communities and corporations in India. And we think we need to deliver it properly. And properly for us in the modern world is to combine technology with actually having the physical competence in terms of doctors and nurses. You need the combination. You still need the doctor skill, the empathy, the compassion to deliver care. So what we said, we want to try to get the best of two things. So use technology when you can to help to make it more efficient. I've seen a few things happening in Europe and in the US, and I think some of the knowledge can absolutely be applied in India, because after all, we're all human beings. It seems like we get the same diseases, we have the same problems, ultimately.
There's a lot to celebrate over the last 7 years. 6 million families trust us. That's 24 million lives. Our members are able to avoid 87% of outpatient consultations. Approximately 11,000 rupees is the annual spend in middle-class families on doctor consultations. So we estimate that our members are saving 9,000 rupees a year as a consequence of using our trusted healthcare services. The other thing which I find a matter of great pride is that we started a few years ago with a pilot primary healthcare service in 15 villages. Today, 2,500 remote villages get high-quality primary healthcare because of the work that DocOnline is doing. The third thing is really about the trust that corporates are placing in DocOnline. 90% of our corporate customers renew with us. So these are significant, I think, achievements over the last 7 years and a great foundation for us to build on. As DocOnline steps into its 8th year, I'd like to say a big thank you to our employees, our shareholders, our customers, our distribution partners for making DocOnline what it is.
So I've been working my whole life and my whole career with service businesses, and I know that people make the difference. In my previous life, we always said happy employees, happy customers, in that order. And I think in DocOnline, if you want to thank someone, you have to thank the dedicated people that make it happen, and that is our employees.
I would like to thank everybody that has been a part of this journey, which we just started. I mean, it's 7 years, but we have many decades to go.